One of the concerns, I think, that have been voiced by opponents of the House, of the public option in the House plan, is that it will make private insurance go up rates because, you know, the public option is so affordable, they'll have to raise their rates. Why don't all of you chime in on, if I have private insurance, therefore I don't need the public option, is this going to hurt me and my private insurer?
I have a lot of concern, Tony, about the price increases, and I think there's not enough in any of the bills right now to hold health care prices down. Quite frankly, I suspect what we're going to see is a bill that's passed that Congress is going to come back and tinker with and adjust over the next several years to deal with it. It's going to have to be addressed at some point. It's estimated now the average family spends $13,000 a year on premiums, and in 10 years it'll be $28,000. So we have to do something about that. There are some provisions in there around evidence-based medicine and some other procedures that I think will help hold it down, but there's not enough.
Dr. Alonso, if you know somebody who runs the free clinics and the FQHCs, is this not beneficial to you to have a public option?
Well, the public option, with or without the public option, it's not going to bring down the cost of health care. So prevention is what brings down the cost of health care, because we invest so much money and we train physicians to take care of diseases, not to prevent them. So until there's a whole shift, and that's way beyond health care reform and certainly way beyond what these bills will do, I think that the option to give people at least access to be able to go and get care, whether it's in a private or in a public section, is beneficial for those who don't have insurance, and that should not make the price. That sounds like the insurance company's crying to me, but I'm not a politician, so I'll get away from that one.
And Paul, as far as providing access, which is really the main focus of Quantum, will the fact that there is insured patients walking in the door help, help fuel obviously the business model of these FQHCs?
Well, I think so. Let's just examine the situation. Right now, according to Families USA, about 6 months ago, over $1,000 a year in health insurance premium costs for those of us who have health insurance. It really goes to cover people who don't have health insurance. I'm not really, on one side or the other of the public option discussion or debate per se, because Medicare and Medicaid are public options, and Medicare and Medicaid will be in this plan one way or another, and expansions of Medicaid, it looks likely, will be in this plan. So there will be more public programs in this plan, whether or not the public option happens. The fact is that when that does occur, fewer people in Palm Beach County will be uninsured. And when fewer people are uninsured in Palm Beach County, there will be less burden on the free clinics. There will be less burden to provide free care for those who bill. And there will be a greater opportunity for the business model of the federally qualified health centers, and for that matter, the business model of hospitals and private physicians' offices to pan out and actually help these people make their living.
Were you surprised, Dr. Fox, that the AMA backed the House bill?
Not really. I think it was the right thing to do, but I think the AMA is also hoping for some relief on the scheduled reduction in Medicare payments to doctors. It's scheduled to go down a fairly significant amount. And quite frankly, Congress does have to fix that, but they've been fixing it on a year-by-year basis. So I don't know if they did the right thing for the wrong reasons, but I'm glad they endorsed it, and I think it's certainly a step in the right direction.
And running the Florida Public Health Institute, do you hear from doctors that are really, really fired up about the whole reform, or are they looking at the positive that, well, now we'll get paid for care?
I think physicians are ambivalent. I'm a part of the Palm Beach County Medical Society. I'm a member. And I think they're ambivalent. I think some physicians believe that, something has to happen, but on the other hand, I think many physicians are wary, not knowing exactly how it's going to play out. There are a couple of provisions in the bills that would be in some ways good, maybe not as far as the medical society and the physicians would like to see it go. One is that Congress would have to pay Medicare rates for Medicaid. Right now, Florida pays way below that. Many physicians, dentists, others are not willing to take Medicaid. That would be a positive step. There's elimination of copays around prevention for people with Medicare. Again, our elderly would not have to pay copays for any kind of preventive treatments, and I think some of those same provisions are in the Medicaid. So, there are a number of other provisions that I think would be quite positive for the community.
And Dr. Alonso, as far as I know, your doctors, you still have volunteer doctors at some of the clinics.
We have both.
Okay, how does this kind of help that maybe the volunteer base wouldn't have to be as broad? You could bring some kind of, payment in to doctors who normally don't even get paid to provide the care.
Well, by increasing our Medicaid number of patients who are Medicaid, what it does is allow us then to use those dollars that we profit and serve other people who still would not have insurance. I mean, I think health reform will cover some, but there will still be many people who still will not get covered. There's not universal coverage at this point. So by increasing the Medicaid and having more people eligible for Medicaid, there's more revenue coming in, and that's exactly the FQHC model, depends on Medicaid to run and run its business.
And I guess you all can chime in. If I have insurance through my employer right now, what in the House bill or a version of the House bill gets through the Senate pretty solidly, what in my life of health care is going to change?
I don't think much, because the way the public option is being portrayed and is evolving is one that may be an option for the states. Even if it's not an option for the states, there's been more of a move toward having negotiated prices and not paying the Medicare rate, which might bring more income in for physicians and hospitals, but it's not going to bring some of the cost savings that we've heard about up to now. So I don't know that there's going to be a wholesale flight of people with private insurance to a public plan. I just don't know that that's going to happen. I think, again, my biggest concern would be we've got to do something to make sure that the cost of even private health insurance remains affordable.
And Paul, I know you touched on it's not only a benefit to obviously what we're talking about, but also the hospitals. Do you mean by alleviating such a rush on emergency rooms? I know that recently there's a study done that shows a lot of people go to the emergency room when really they could be almost at a basic primary care clinic. Is that where you're going with that thought?
Well, in part, yes. In 2007, about 43% of the patients, insured and uninsured, who showed up in hospital emergency rooms in Palm Beach County across all of the hospitals were there for so-called non-emergency reasons. Which means most of those probably could have been taken care of in a primary care setting. So there can be great relief on the hospital side, on the emergency department side, but also on the outpatient and inpatient side. Remember, uninsured people do show up and do need health care, and in fact, uninsured people tend to be sicker than insured people. So they place great burden on the healthcare providers, and anything that would reduce those numbers of uninsured people and provide additional revenues to healthcare providers would be welcome in Palm Beach County right now.
And Alina, as far as you know, will the dollars be there to implement these changes that will pretty much affect you the most drastically and quickly as the health department director? Are you concerned at all about where the dollars are going to come from, that taxpayers will be upset at the end of this?
Well, I'm very concerned that the state will decide not to play along. And we'll have this whole debate over health care reform and everything, and the state can just opt not to participate. That concerns me. As far as the taxpayer, I think that they need to be very aware of where their taxes are being spent and how they're being spent. And I think Palm Beach County does a fairly good job, but I think it needs to do a better job. In terms of behavior, of your question of behavior, I think that is outside of the health care reform bill. That is something that we need to stress to people, to take insurance and then to act on that insurance. So that's a behavioral pattern that we have to get people to go ahead and go to the doctor when they're sick and not wait till the very, very end.